yeah, you should get involved. You need to get involved because the more people who speak up and speak out will get the message across. For too long, we have ignored the voice of direct care workers.
Today, more than 13 million people need long-term care.
These men, women, and children depend on the care and support of direct care workers in order to be active in their communities
And maintain their quality of life.
Now, imagine this.
Soon, more than 27 million people will need this care.
That's more than double.
in order to make sure that the elderly and people living with disabilities get the care and support they need. We must improve direct care jobs.
With your help, the Direct Care Alliance continues to empower direct care workers
through training opportunities, better pay, and better benefits.
Direct care workers and the people who depend on them have found their voice.
I'm part of the movement.
I'm part of the movement.
Use your voice.
Use your voice.
And join the movement to improve direct care.
People are much happier in their own homes. And the only way they can stay in their own homes is to have the help of a home health aide or the direct care worker.
Right.
It wasn't what I thought it would be. It was more than what I thought it would be.
It's been very rewarding work, knowing I'm helping somebody, but on the flip side of that, it's hard to put a kid through school on direct care worker wages. It's hard when you don't have any benefits. So if you get sick, you still go to work because you can't stay home, because if you stay home, you don't get paid.
The workload is really hectic. So I think more benefits and more pay for that type of work is really necessary.
It's good to have good pay. We all would like good pay, we all would like good benefit, but to know that the person that you're taking care counts more than the money.
Can you think of a client who has really touched your life?
So much. But then he started to lose consciousness, and I really felt like, oh my God, we're losing him just like that. It was like kind of like, my God, this could have been my mother, my father, brother, sister. So it was really touching, and I'm like, oh my God, we can't lose him. But we get help for him in time, and he went out to the hospital and everything was fine. So sometimes it gets really personal when you see these things happen right there and then.
If you weren't there, he could have died.
Yes, definitely.
The hospital had suggested I go into a rehab center or a nursing home for that time, and I just didn't want to be away from home. And I kind of insisted that I could do it with some help, and I did. I managed to do it.
And to me, is incredible, really incredible that her disability did not stop her, did not end her life. She's not in a home somewhere depressed. She's picked up the pieces and moved on.
They're extremely important, and they should get higher wages, opportunities for improving themselves, and appreciation from the community.
It's really important for both the community, family members, the workers, and the patients to come together.
The movement is everyone, because the direct care worker will help a family member, or like say mom, and that allows son or daughter to go and work, to have a job, to keep an income.
And if they have to stay home to take care of their loved one, it means that that's putting a little pressure on the home.
We all need to have a really stable direct care workforce that is qualified so that we can remain as vital in the community with our loved ones for as long as possible.
Some funders sometimes hesitate to support groups like the Direct Care Alliance, but in our experience, by providing direct support to workers and their organizations, we're able to more effectively support their goals and improve working conditions and training opportunities for workers.
If you'd like to learn more, please click below.